And there's a robotic voice, and we're good to go. All right, great. So thank you again, Melissa, Jackie, Dee, and Akari for that report. And we are going to move on to our main topic today, which is part 2 of our housing panel. Last month, John and Sue Giovanetti from the Plymouth Coalition talked about the efforts locally to serve and protect folks who are unhoused, and what that looks like. And John talked a little bit about sort of that transition to the next step, which is finding more permanent housing solutions. And we're glad to have John Yazwinski back from Father Bill's and MainSpring House. And after John does his presentation, we're going to hear from Maureen Fitzgerald from NeighborWorks Housing. And these are two very important main players in the affordable housing space in our area. So I really thank them both for being here. And John, I will turn it over to you.
Well, thanks, Michael. And it's great to be back. Again, Father Bill's in MainSpring, and we, of course, provide shelter and housing for families and individuals throughout Norfolk and Plymouth County. Just quickly, if people weren't with us last month, we'll shelter any given night over 250 individuals in the region, all the way from Quincy, Brockton to Plymouth. We'll shelter over 133 individuals. But I'm excited today to really talk about supportive housing, permanent supportive housing, and our role in it within the region. So I'll ask Pat. Yep, I think he's getting the PowerPoint ready. So permanent supportive housing, what does that mean to Father Bill's in MainSpring is, and what is our role in when people come to us? So about 60-70% of families or individuals that are experiencing homelessness really just need us short-term in the emergency shelter world to connect, get local resources, and hopefully transition on in a few months. But there is a core group of people that really struggle, that are chronically homeless, episodically homeless, high needs like behavioral health, mental health, substance use, physical disabilities, that really are going to end up being long-term, experiencing long-term homelessness if we don't create a pathway to supportive housing. So Father Bill's in MainSpring in the early 2000s converted the way we looked at housing to really be housing first, which is really a harm reduction model. It's really the ability to go into the community if somebody is unsheltered or sheltered and give them a key, get them into supportive housing, and really work on bringing the services around them. So if somebody is struggling with substance use or mental health issues, that is not a barrier to get into our low threshold. We will accept everybody that comes in to the degree of the vulnerability of them. So there is a real push nationally called chronic homeless. There's a definition, but really we're looking at the high needs people in the community. And what we found is when we target that 20 or 30% of the population, it really then allows the shelter experience to be more of an emergency room triage brief experience, because you're taking the people that take up the majority of the resources at the shelter and giving them that supportive housing. So our housing is 0 to 30% medium income people, and we're really targeting the people that have been homeless the longest, in a sense of what we developed there. So Pat, we can go to the next slide. Currently, Father Bill's in MainSpring operates more than 700 units throughout the region. That is a combination of scattered site apartments that we lease, and or the family or individual will have a subsidy with us and they can go out and find their own housing. And then we provide the community-based supports of case management. And then we also develop housing, and we'll speak to that a little bit more. And we have great partnerships like with NeighborWorks, where they've helped develop about 100 units with us through the years that we lease from them. You can see the majority of our units are for individuals and veterans. 80 units are for formerly homeless families. When we think of really more of the Plymouth region, Plymouth-Wareham area, I know for this crowd, we currently operate of that 700, about 104 permanent supportive housing units in the southern region of Plymouth and Wareham. And we're excited to say that we've got 8 more that are in the works right now, that people are in housing search in the greater Plymouth community. What's really the challenging is if you have any type of subsidy right now, the housing market, you can't find units. It's a combination of the rents are too high for what the subsidies would pay for fair market rent. So every year HUD does increase usually the fair market rents of like Section 8s and other HUD programs. A lot of the subsidies that we get, we can't go above 100% of the fair market. A lot of other programs can go up to 110 or up a lot more than that. So our people do get we are losing units to other groups like housing authorities and places like that. So it makes it really hard when you've got a lot of old housing stock that struggles to pass inspections. When you have a vacancy rate that there is no vacancies out there that, and we're just not building enough in the communities of affordable housing. So it's a perfect storm of why we're seeing more families and individuals experiencing homelessness right now. And we're excited that we've been able to also the last couple of years bring some more units to Wareham. That's been a community that really doesn't have a shelter system. We see an unsheltered population there, and we've really focused on trying to bring some of the HUD money to that region also. Really, what we're all about, of course, is making sure people don't end up becoming homeless again. So, 97% of the residents stay housed for 1 year, and 93% of those residents stay housed for 3 years. This is not transitional housing. This is permanent supportive housing. Everybody has a lease. Everybody pays 30% of their income towards the rent. Now, does everybody pay their rent? No, not in our program. And really, housing first means it's a harm reduction where we work with people to pay rent. But we do not evict if people do not pay their rent. All they'll do is end up coming right back to where we started with, on the streets, because the majority of the people that we're housing haven't had housing in a long, long time. I would say also that when we think about Plymouth and everything, we think about it more of our housing stock there is all scattered site. So we're going out, our team that works in Plymouth is going out and finding individual landlords. We have a great network of landlords. We have one landlord who we rent about 6 buildings from. So it's really about community partnerships, working with landlords, having a long-term commitment there really makes it easy. But we haven't done a project, a specific housing development yet in the community there. Here's just some examples of some recent projects that we're really excited about. The first one on the left is called the Roadway Apartments. This is 69 units, and it was a hotel. During the pandemic in Brockton, we leased it for a shelter as we were trying to depopulate the main shelter in Brockton. And so while we were in there, we said, geez, if we put kitchenettes in each of these units, we could convert this facility into permanent supportive housing. And these could be efficiency apartments with some minor rehab. So we're excited to say that we acquired this building over the last few years. We renovated it, and now we've converted the whole building to 69 units of permanent supportive housing. It's the first in the state for hotel to housing conversion for homeless individuals. You can see the before and after. You can see on the left the hotel room, and then you can see how the kitchenettes, what we did, the kind of renovations that we made there. In a sense of housing development, and I know Maureen knows this better than I do, it takes 3 to 4 years or longer to really to develop an affordable housing project on average. And this project took about 18 months from beginning to end. And that really just showed us that if the political will is there, the need is there, of course. And if all the funders are on the same page, and we did it because it was the middle of COVID and it was a priority for the state, it got done in record time. A good example of what we did a few years ago in Wareham is there was a lot of land that a Buzzards Bay community preservation group wanted to purchase. And in the middle of a lot of the land in Wareham, there was a multifamily sitting there that was empty. So they needed a local housing provider to be a part of that project. So Buzzards Bay Community Preservation and Father Bill's joined together, went to the town of Wareham and received community preservation funds, CPC funds, and we were able to purchase, Buzzards Bay purchased probably over about 8 acres for preservation. And then Father Bill's was able to carve off about an acre to develop 6 units for homeless individuals in the Wareham community. What a great partnership and what a great project at a local level. And another example is recently during COVID, we had Envision Bank come to us, and they had a large parking lot in one of their branches in Randolph that was underutilized. They had heard about some of our other veteran projects, and so they donated land of their parking lot, and jointly we developed 10 efficiency apartments for veterans. And very excited that it kind of fit right from the neighborhood to commercial. So it's kind of right on that edge of where the neighborhood kind of ends and commercial kind of starts in that area there. And again, it's been a wonderful project, and it takes the community, it takes different partnerships coming together, and the bank's been a great supporter of this. Really, to do projects like this, I'll go back to, you need local political will. You need local support for people at the leadership, community leader level to say, yeah, we have a problem, and you know what, we're all going to back, a potential project. Then what you need to do a project like developing supportive housing is you need some local dollars. If the dollars are there, the community has, either any kind of housing dollars, home dollars, CDBG, community preservation, affordable housing trusts. Not every community has these, but if they have some money, then when you go to the state really expects the community to put a few dollars in, so that then when you go to the state, they know that the local community's got some skin in the game and that they're supporting the project. Our hope would be big picture is that we know we've got a lot of ARPA money out there right now, and a lot of it has been at the state level has been committed to housing, which is wonderful. And we've got some state ARPA projects that are in the works. But boy, it would be really nice to use some of the local ARPA money to match some of the state ARPA money. And I know that Senator Maureen had some meetings about the ARPA resources, but boy, it'd be great to do a project like this, and I think what I was hoping here is, Father Bill's in MainSpring will do all sizes of a project, small to medium. 69 is really big for us, but it's gone really well with a hotel conversion. It's of course a maintenance and scattered site difficulty, but I think we face such NIMBYism, not in my backyard, in the communities about the population we serve, that when we have opportunities with political support, we really try to make it work for everyone. So lastly, just briefly to wrap up, Father Bill's in MainSpring is really looking at the individual shelter system, how everybody in the state, we kind of warehouse people. And so we're converting both our shelter in Quincy, Father Bill's, and our MainSpring shelter. We're putting in new facilities, new buildings, really to not just be an emergency shelter, but to be a housing resource center that really focuses on progressive engagement. So it's a center where people will call us or come to. We really want to focus on prevention, diversion. Can we divert people? Can we prevent people from ever even having to come? And then can we rapidly rehouse them again with some flexible dollars for that, 50, 60, 70% of the population? A lot of times people are just sitting in our shelters, just saving up for first, last, and security. If they had first, last, and security, which are thousands of dollars, they would be able to move immediately. We want to be able to really convert the shelter model to a new model, really operating more like a medical emergency room. And in Quincy, we're excited to say with this new housing resource center, we're excited to say right next door to it, we're building 30 units of permanent supportive housing. And then if people are familiar with Quincy, where Father Bill's is behind the police station on Broad Street, we're going right across the street on Broad Street. So the city's doing a major development, and thankfully we're part of that development. And then in our next big project that we're trying to get funded is in Brockton. There was some federal land by the VA system off of Belmont, where the VA system is on Manley Street. It's an old National Guard building. We applied to the feds to obtain the land, and we've got site control. And so our hope here is to replicate what we're doing in Quincy. Quincy is being built right now, is to replace the MainSpring shelter to a resource center, very similar. And then we're excited to say 32 units of permanent supportive housing, really targeting that chronic homeless group. And again, it's been wonderful with these communities, with our track record, to have the political will to make these things work. And we've been able to build projects and do projects even in other communities like Hingham, like Hull, and Weymouth. So, if people are aware of any other hotels or motels that are out there, we're looking at doing another one right now in a local community. I won't say yet until it's public, but really appreciate the opportunity to share a little bit about what we're trying to do to provide supportive housing for people in need in our greater Plymouth County communities. Thank you.
Thank you, John. This is great information, and really important stuff that you're doing. I have to say, it's been a few years since I've been to your Quincy facility. Obviously, it's gone through some changes, so I'll have to schedule a visit maybe when you will open the new facility. I want to check that out.
That'd be great.
I had a few questions, and I'll open it up because I know your time is limited. The folks that are being placed in the permanent supportive housing, are they mostly coming from your shelters or from the shelter system overall? How's that work?
So there is, we have a kind of a South Shore regional network, a continuum of care, they call it, with HUD.
Right.
So in that, there is what they call a coordinated entry process. So people are basically kind of put into the coordinated entry process. So any homeless providers, not just Father Bill's, can enter people into that process, and it's like a kind of everybody's kind of scored, and then it's done that way. So some projects, I would say the majority of the individuals are coming from Father Bill's and MainSpring for individual units, because we are really the only established shelter program. Plymouth Task Force for the Homeless, of course, has been doing great work for years. We partnered with them on the overnights hospitality in Plymouth, so those people get put in. On the family side, you've probably got all the family shelter providers. There's probably 5 or 6 of us in the region being able to submit for openings.
Great. And I see a related question in the chat from Carlisle's. Can you describe the vetting process for people who are moving from shelter to permanent housing?
Yeah, so right now, if it's not a lottery, if the state funding makes us do a lottery, then there is a lottery where people are put in and kind of drawn out of a hat. Right now, the vetting process right now, queries really aren't a barrier. Income is not a barrier. Don't have to be clean and sober. So there is income eligibility, of course. You can't, you got to fit within the income. Mostly everybody is below 30% median income. And then you're put into the court. So everybody that goes through this, there's a vulnerability index, the assessment done. And so that score, it's a national scoring system that HUD endorses. Everybody's kind of put through a vulnerability score, because we want to make sure that our housing is prioritized for the people that are the most vulnerable that are out there. So the people that get the higher score are the ones that get targeted first. But we literally, if we have people that are literally outside in Plymouth, outside in Brockton, we walk and they're on our, we have outreach teams there. If they're on our list and they win and they get the lottery, we're walking up to them and giving them the key straight from the streets. They do not have to come through an emergency shelter. It's a pretty low threshold to get in, and is what I'm saying. It's really about it. Now, some of these projects, we really tried to stay away from low income housing tax credit programs. But they have a lot more barriers. HUD makes it very easy part of the hardest thing is documentation. People that are sleeping outside, they don't have documents. So we get in trouble from HUD and everybody else about documents. And I'm like, if you want us to walk out on the street and hand somebody a key, you've got to relax on the documentation. Give us some time to develop that. But the low income housing has been really challenging because here we have 69 homeless people during a pandemic, and, low income housing wants you to have 7 years of tax returns. I'm like, I couldn't even give you 7 years of tax returns. Why are you trying to make the homeless person have 7 years of tax returns? So we've still got to try to get the bureaucracy to be a little more accommodating to people that are experiencing homelessness.
One other question I had, then I'll throw it open. I'm sure people have questions. The landlords you're working with, how do you find that process to go, and how do you find the landlords who are willing to do it? And given that I think a lot of us know that some of the housing issues that are happening are because landlords are finding that they can raise rents and they can, get a lot more money. How do you manage that process, I guess?
Yeah, I mean, so, we really look at our landlords as like donors, right? If we can have a landlord that wants to have a commitment with us. So we do really well with landlords that get to know us. A lot of it's word of mouth that they all talk. We really have to be responsive to them. And I think that a lot of them will stay with us even when times that they may be able to make more money, temporarily, because they know that we're going to help if there's behavior issues, if somebody, they get less time that they're going to court to kick somebody out. So there's some, soft and hard cost savings that it's a relationship with those landlords. We absolutely right now are struggling with finding new landlords that are willing to join us for the long term, knowing how much they can make in the open market. But we absolutely really try to have a network of landlords that really will partner with us.
Great, thank you. Does anyone else have any questions, comments?
Hi, this is Charlotte Tarsi. I'm the program manager for the Plymouth County Hub. I just want to say that I am super thankful for Father Bills, who attends our meetings and helps with the situations that involve homelessness and housing. We have seen an increase from 2021 to 2022 in the number of situations coming to the table that are related to housing. So we know that this is definitely a major issue. And I do have some data. So if there's anything that you could benefit from having from the hub, I'll just pop my email in the chat again. But Taylor, Josh, all of those guys, they all have my email. So, I'm pretty passionate about this. I know we need this in this area, and I really appreciate all the work you guys are doing.
Thank you. Definitely, Pat, if we can connect with Charlotte, that'd be great. Thank you.
Any other questions?
John, if I may, curious as to what happens when folks are violating a tenancy, kind of illegal activities, those kinds of things. How do you handle that? Yeah, so, again, we still have to provide safe environments. We really focus on, if the behavior, if it's, related to substance use, are they willing to work with us, right? Is somebody willing to work with us? And if they're willing to work with us, and if it's not like a unsafe place, or we can get them into treatment immediately, then they can come back to the housing. So we really try that progressive engagement harm reduction model. But absolutely, if there's people that are continuing maybe to provide an unsafe environment, not just for themselves, but the other people in the building, then we absolutely will work with them on saying, all right, maybe we've got to remove you from the housing
Ideally, we really try to get them to leave without evicting, because we really don't want that on their record, so we can hopefully work with them in the future. But sometimes we have to do it. So, but we definitely really try to wrap around as many services. I think the people that don't make it, in our housing are really the ones that really close the door on us and say, like, I'm not going to work with you. And then they're going to not, really cause concerns of safety and security for the other tenants.
Excellent. Thank you, John, so much. I know folks will probably have more thoughts and questions, and we'll definitely pass those along, and excited to hear about all the new things that are going on, and I'm sure you'll keep us abreast when you bring one of those housing resource centers down to Plymouth, which will be all right. Great. Thank you, John. And thank you, Patrick. Okay, so I want to ask Maureen Fitzgerald from NeighborWorks Housing to talk a bit more about their programs, dealing maybe with a slightly different different universe, I think, than Father Bill's does. So, and very excited to hear what Maureen has to say. Maureen, floor is yours.
Thank you. And are you able to see my screen?
Yes.
Okay. I always, that awkward,
Oh yeah.
don't want it like, oh, everyone's reading my email. Great. Okay. So I have to say we are really lucky to have Father Bill's in the area. We have partnered very frequently with them on projects, and it's always a pleasure. And they really are, throughout the state, we really have an innovative resource here. So it's kind of hard to follow John, but Mike had asked that I talk a little bit about what's happening with efforts to increase affordable housing and how you can help your clients, patients facing housing insecurity. I've thrown a lot on the slides, but I'm going to send them. I'll send them to Mike afterwards. So don't feel like you have to be frantically writing things down. First, I wanted to just tell you a little bit about NeighborWorks Housing Solutions. You've got sort of our basic facts and information there. Our real estate development. We have about 900 units across Plymouth and Bristol counties, some up here in Quincy. We often will partner with nonprofits like Father Bill's and MainSpring, so we're very happy to be able to do that. We have a variety of housing projects, from very small scale community residents. For example, we've partnered with Work Inc., where we have a community resident that is just for people who are deaf and hard of hearing, to much larger scale, 100-unit mixed income buildings, some workforce housing. So we've got a real variety of actual buildings, some of which we manage, some we work in partnership with other property managers or with in our supportive housing units with places like Father Bill's. We also do we have a small shelter program, but we're also on the housing services side. So we administer a number of rental assistance programs, a total of about 2,900 units or vouchers across the area. We have a number of housing resources, information and referral, RAFT, first-time home buyer counseling, just a whole variety of different services. My role here is external policy and outreach. So I get to work with communities and oftentimes with the legislature, the state legislature, and then sometimes I get the pleasure of working with people like Mike and Congressman Keating's office. And one thing that I would say sort of overriding is right now I think we're in a pretty good place. As John pointed out, we don't there aren't enough units, right? We all know that, that's a given, but there has been an infusion of resources, particularly with the ARPA funds, whether they're gone to the state, or they have gone on to, or if they're in the local community, which I think is a really good point to emphasize that, John, because those aren't as readily and easily accessed. But there's also a lot of, within the state legislature, there's a lot of momentum right now. I'm in a position where I hear a lot from legislators who are calling with questions and concerns. And I have not seen this much of an interest, not just to get a question answered, but to ask, what can we do? And we do have in this part of the state some very engaged and active folks. For example, a little further north in Plymouth County, Rep. Moschino, and then out over in, I think, Attleboro's in Bristol County. But those two reps are the co-chairs of a caucus to end and prevent homelessness. So that's something new this year. They're also, Rep. Moschino has sponsored legislation to get more permanent supported housing. So there's definitely, with this new session, there is a greater emphasis than I've seen it on in the past, which obviously we're really pleased to see. So in terms of the current state, did that slide change?
No, I don't think so.
Sorry. You know this, you think you're so slick. There we go. Okay. I think it changed that time. I thought John had some pictures of their developments. I would have to, I'm obligated to show some of ours. The one on the left is downtown in Brockton. It's got some retail space on the first floor. Then the middle one is in Marshfield, Veterans Home, which I know that Father Bills is very familiar with. And then the one on the right is that workforce housing that I had mentioned. The only reason I show you this slide, it actually reiterates something John talked about, the challenges of development. And seriously, that turnaround for your Brockton roadway project was phenomenal. You can see all of the different resources there. Those are just the federal and the state resources. That's not the sort of local CDBG and all those other resources that John talked about. So it's a challenging project, and it takes a fair amount of capacity to be able to take on a project like this. So you can see how overwhelming that is. But this is one side of the equation, which is the supply for affordable housing. We have been, I think, in the state successful at putting more and more money into it. John mentioned we've got to try to figure out a way to be able to do it more quickly, increase the capacity of people to do it. But that's, those are sort of the challenges with supply. The other thing that relates to that, and that you'll hear about and you see in the papers, are what's happening with zoning. That's something that in Massachusetts, on a statewide level, a lot of groups have been very involved in. The most recent governor and current governor are working to try to get greater density in MBTA communities. And I did look, when I looked at the towns that were in this group, in this area, and there are two communities, Marshfield and Carver, that are still on the list for not having submitted a response to the MBTA communities. So there are still opportunities to work within the local communities on a very local level to have voices heard about the need for more affordable housing. So that's all I'm going to say about development. The other side of the equation is how to increase the affordability. We can't build our way out of this. There's just not enough land and money, and we don't have enough time. So we are really fortunate here in Massachusetts that there are so many resources. But from someone who's trying to assist a constituent, it's really complicated because there's not one place you can go to. Although I'm sure when the housing resource centers are done in Quincy and Brockton, they'll have it all. They'll be I don't need to sound like I'm joking about it. In all seriousness, I'm sure we'll be working closely with Father Bills. But it is a very confusing system, and there are a lot of different providers. So in this slide, I've just sort of listed for you for future reference. Okay, where are the resources? Who's got them? How do I find them? Generally with rental assistance, it's either in this region, it's NeighborWorks, because we're a regional housing agency, or it's a local housing authority. Within your communities, though, I noticed that Plimpton doesn't have a local housing authority. So all the other communities there do. So those are, I'm not going to go through these piece by piece, but you can see some are rental assistance where people find apartments on their own. Some are public housing. That's all generally through the local housing authorities. And then, of course, we've got some short-term fixes, things that came about as a result of COVID and some resources we had before. The COVID resources right now are primarily for homeowners. And then, of course, we still have the state resource, which is RAFT. Within those, that last slide was all the federally funded programs. These are state funded. We're really fortunate in Massachusetts to have a commitment from the state. We are one of the few states that has a rental assistance program that's supported by state dollars. It's actually, I believe it's the largest state-funded program in the country. So that's also another resource. I just threw a slide here to give you more specifics on, okay, we've got these resources. You've got these resources at NeighborWorks. How do we get access to them? So here, this slide has the information about where to find those applications, who it's through. So we've got the permanent ones, and then there's the short-term programs. I would note that home-based, although we administer it, people access it through the DHCD homeless coordinators, which are in the transitional assistance offices. For all of the communities I see on your list, it's the Plymouth Transitional Assistance Office in Industrial Park, with the exception of Rockland. Rockland is affiliated with the Brockton office. So those are that gives you a sense of how to get those resources at our organization. A bigger picture issue about all those resources, it's challenging to navigate, and also clearly the scarcity of resources. Yes, we have rental assistance. We have 2,900 units of rental assistance that we administer. We opened our mass rental voucher waiting list about 1.5 years ago. In a 2-week period, we got more than 4,000 applications. We had 200 vouchers that we were able to issue. So you can imagine the waiting list. People are on those waiting lists. It can be a matter of years because of the scarcity of the resources. So the number one piece of advice I would give anyone working with constituents is to get out there and get on as many of those lists as you possibly can, and make sure you use a PO box or something where you know you're going to have an address that's going to stay updated, because there's nothing worse than someone finding out, oh, I was dropped from the list because I didn't return the update because I moved. So that's often a PO box is helpful. We have one of the programs that we have in particular. It's called the Housing Consumer Education Center. So we have staff that are funded to do information and referral, and they can be a good resource for your staff. I've got the contact information there. They also want to know, this is kind of a two-way street. It's also helpful for them to know. Oftentimes we'll have someone come in saying, oh, I need housing help, I'm being evicted. And well, it turns out really they're having trouble because they applied for Social Security, but disability, but they haven't been able to get through that. Or there's an issue that's really a medical issue and that needs to be addressed. So we really, as much as we can, try to network with other providers in the region so we can, as much as we can, streamline things. We also do outreach and have more sort of proactive information there. It's best, frankly, to call or email, and people will get back to you. In some cases, we do take, if we have staff that are free, we'll do walk-ins. But it's helpful to do that sort of initial, if you can set up an appointment, that's generally best. I also threw some information on here about RAFT because it is one of the few immediate short-term resources that are available. The guidelines have changed a little bit since last year. I've highlighted the key changes. So I've got that up there for you. Also, I threw a cheat sheet in here. It's just a general listing of the programs, the sort of really targeted at homelessness and housing programs. Like, how do you access these resources? Where do you go? What are the income limits? Because some of those income limits, frankly, we generally don't see a lot of people who have trouble with the income limits. We serve an awful lot of people who are below 30% of area median income. But increasingly, as rents are being raised, we're getting calls from people and that where someone is calling and saying, I've never had a problem paying my rent, but it's going up $300 starting next month or more. So we are increasingly seeing, people with higher incomes who are struggling to pay the rent. So this is just some sort of basics. If you're trying to figure out at a glance, like, oh, should we even be looking at this resource? Is it a possibility or not? So that is on that. The only other thing I would mention, and I don't think I noted it here, was, sorry to jump back, but on RAFT, if someone's in subsidized housing or assisted housing and they're having trouble paying their rent, the bureaucracy, John, the requirements are a little more onerous. They have to be able to show a reason they weren't able to pay. And that's another thing I would just mention, because it's sometimes a stumbling block for folks. Other than that, I have tried to be mindful of the time, fly through the slides. So I don't know, hopefully I got at some of what you were looking for, if not all. And I don't know if Mike or anyone else has any questions.
Maureen,
And I think I stopped. Did I stop sharing my screen?
No,
Yes.
you're still up there, but I'm sure people want to get that number down. And we
Oh,
will
I will send it out to you.
Yeah, we will get those slides so that folks, and that cheat sheet is really helpful because I always talk about lists, and people need to get on the list, and like, what list exactly do you have to get on? Now, when I worked in the State House way back, you had to get on if you were trying to get into a housing authority locally in your town. You had to get on the list of each individual town. Is that still the way it is?
For some programs and not others.
Right.
So nothing is clear, nothing is straightforward. I also, honestly, I have a slide that I had done for some legislative staff that had links to the statewide applications and all of those. I can send those along as well if anyone feels like that would be helpful. There's one that's, there is a centralized waiting list, however, for state aided public housing. It's called CHAMP. And I see people nodding. So I think Sounds like you're familiar with that. So that has been really helpful in terms of having it one application. The state is also talking about having their MRDP program go into that system, but that hasn't happened yet. And some of the housing authorities, there's a separate group of housing authorities that also have a centralized list. Any of the rental assistance, the Section 8 through DHCD, you used to, you could apply at Metro, you could apply at HAC on, Housing Assistance Corporation, on HAC on Cape Cod, and you could apply through us. Now that's all centralized. But there isn't just one place. There is also, there are a couple sites that the state has tried to pull together to assist in housing search. One of them is Housing Navigator, housingnavigatorma.org. This is on the other slides I'll send you. And the state has worked with affordable housing developers so that as new units come online, because some of those applications are through the properties, through the property managers. So now as those come online, they're required to list them with the Housing Navigator. And so you can go in and you can put in Plymouth and see what comes up for Plymouth. So there are definitely have been some efforts to make the process a little clearer, but honestly, it's still quite challenging.
I think that Housing Navigator it could be really helpful because folks who are in housing crisis, they don't need to be, put through the ringer and trying to find a place. If their landlord evicts them or they raise the rent by 100%, it's not a good time to be barraged with a logistical challenge. So the easier and more streamlined the process can be, the better.
They also, there was a website called Mass Access, where developers were required to list their accessible units, and, not just visitable, but the accessible units. And that actually has now been incorporated as a corollary to the Housing Navigator mass.org site. And I can't think of it off the top of my head, but it's on the list with the slides that I'll send you.
Great. Just a few things from the chat. Karen from DTA said that, oh gosh, I lost it. Oh, okay. No longer a DTA office in Plymouth, and the towns covered by that office are now divided between Brockton and Taunton. So thanks for sharing that, Karen. Kathleen, did you have a question about the DMH Safe Haven program?
Can I just mention one thing, Kathleen? Then DHCD's got to update their website. I checked on their resource, and it was one of the links I was going to send you as a good link. I guess it isn't on the resource finder, because if you go into any of those towns, it still says Plymouth. So that's really helpful to have that update. Thank you.
Yeah, and just for folks' knowledge, since COVID, DHCD is only physically present in some of the DTA offices. I think the closest ones in our area would be Brockton and New Bedford.
Thank you.
Kathleen?
I'm so sorry. I was also trying to be part of the hub meeting at the same time. I apologize.
Multitasking.
Yes. So the Safe Haven program that DMH talks about, how does that work with your program or with Father Bill's? I'm confused about how that fits into things.
I'm not familiar with the Safe Haven program, so I'm not sure how it fits in. I don't know if John or Pat is still on,
I think
because I know John had a hard deadline.
Patrick's still here. I don't know if you can answer that, Patrick.
If not, I'll approach that through DMH and see how DMH works with your two organizations. Thank you.
Great.
Yeah, and we do partner with them on some permanent supported housing programs. And generally in that case, DMH provides if it's maybe a closed referral, they would provide the referral, they would provide the ongoing service support, and we would provide the rental assistance. So,
Thank you.
but that one in particular, I'm not familiar with, sorry.
All right, great. Any other questions or comments from Maureen? Well, Maureen, thank you so much. We really appreciate your time in putting those resources together. We look forward to getting that those slides. I know people will be really eager to get that cheat sheet. I know I am, and I think it's really helpful to know which program is which. I have a few quick announcements. First, most importantly, we are hosting our Health Literacy Awards again for 2023. We will be presenting the awards at our annual meeting in June. And sometime, I think between now and our March meeting, Kim will be sending out the nomination forms. And we'll ask folks to get the nomination forms back to us by the end of April so that the steering committee can take a look at those. So anyone that you are working with, know in the community who is doing something to increase awareness about health topics, easing access to health information, overcoming obstacles to health literacy. We really want to find out about them and celebrate their work. So please share those nominations once that form goes out. I just want to give a little preview for March. Mental health obviously is a huge topic and has been ongoing, and again, with COVID has become even more of an issue. So we are hoping to hear a combination grant report and a presentation from the Plymouth Suicide Prevention Coalition in March. And we'll also have from Plymouth Community Intermediate School, I think their name is Judy Duarte, who is the advisor to the Yellow Tulip Project. So we're looking forward to that as well in March. And I think Sam Correa from the Duxbury Library had to jump off, but I know she is working on putting together some resources for the community of Duxbury, obviously dealing with the tragedy that they went through. And we are hoping to support that, connected her with the coalition, connected her with NAMI as well. And we will certainly let you folks know about any upcoming events, programs, whether they're in person or virtual, that we can all kind of benefit from. I know Kim sent out last week, there's a Cape task force on maternal depression, and they're doing a webinar or a Zoom meeting the first week of March, which looks very intriguing and interesting. So as we hear about those resources, we'll share them with you, and we ask you to do the same, because we want to make sure that we're getting information and resources out to as many people as possible. So with that, I'll throw it open if other folks have announcements or programs that they want to talk about. It's almost springtime. There's got to be stuff going on where we're all able to be outside and be together.
Michael, if I can, I'll jump in. I know a lot of you probably deal with a lot of Mass Health clients as well, with insurance issues. So I just wanted to, I can put it in the chat, the link to the website to join the MTF meetings. So we have quarterly meetings throughout the state that Mass Health, Health Safety Net, the Health Connector actually deliver pertinent state policy information to anybody that's on our listserv. So I'd love to have people join, especially now with the changes in the coverage requirements that are going to end on April 1st. I know some of you mentioned SNAP. I know some of the COVID benefit from SNAP will be ending. So it may be that you want to join and just get some information. So I'll stick that in the chat if it's okay.
Yeah, definitely. Please put it in the chat. And if you don't mind emailing that to Kim as well, chana23@gmail.com. Kim, is that right? I always get confused between chna.org and gmail.com. So the CHNA23, and Kim just put it in the chat, at gmail.com. If
Okay.
anyone has any programs or announcements, please feel free to send that to that email address.
Thank you.
Thank you. I know that the Beyond NAS conference held by To the Moon and Back is coming up on March 10th. I believe it's at the 1820 hotel, 1620 hotel, whatever they call that now, the old Radisson down by the waterfront. And I put in the chat, there's an announcement that Maureen mentioned, Rep. Moschino and Rep. Hawkins with the caucus to end homelessness. I know they had a virtual sort of hearing. I think it was last Friday, but I think they're going to have more coming up. So we'll definitely keep on top of that and share those with folks when they come out. And
Can I add one quick thing
Yep.
about that, actually? There's also specific to Plymouth, Senator Moran has been convening on a regular basis a housing group. So there, and it's been attended by Rep. Moratori, Lenatra, Rep. Lenatra, you know, there actually, there's a good, strong interest in affordable housing within the Plymouth delegation as well. So just thought I would share that.
great, I'll definitely try to get some more details on that as events or programs or opportunities to learn more and to give your input come up. And I think I mentioned last month, but I'll mention again, it's not in the Plymouth area, but Congressman Keating is hosting a forum on affordable housing in April. It's going to be April 12th at UMass Dartmouth. We will have the regional administrator from HUD joining us, as well as some HUD personnel and Mass Housing and Preservation of Affordable Housing and CHAPA, Citizens Housing and Planning Association, will all be presenting as well. So I will definitely get the word out about that if folks want to do a day trip over to Dartmouth, which is lovely in April. Okay, and Kim just put in the chat that oh yeah, Karen Peterson very nicely had set up some grant writing sessions for us and through BID. And those are you can sign up for those at that link that Kim put in. And Kim, did we send that out in the email too?
We just blasted it out this morning around
Okay.
8:30. So yeah, you should see it in your inbox, but we also linked it on the website and social media if folks want to spread the word.
Yeah. So as unfortunately the Chena South Shore Community Partisan Prevention is our ability to disseminate funds is decreasing by the amount of funds that we have. We want to make sure that people have the tools and the resources they need to be competitive for grant funding from other spheres, federal, state, local, foundation grants. So those will be, I think, really helpful and really, really informative for folks. So please do check those out. So if there are no more announcements, I would entertain a motion to adjourn. Karen Peterson, thank you. Second. Melissa. All right, great. Thank you, everyone. All those in favor of adjourning, just turn off your Zoom. Thanks, everyone, and have a great day, and we'll see you next month.
Thank you.
Bye-bye
Bye
now.
all. Take care.